Hello again, everyone. This is Jonathan Marks from Go to Health Media. This is video 7 in our series, How Project 2025 Will Change Healthcare in the United States. Project 2025 is the 920-page conservative agenda set by the Heritage Foundation to be implemented if and when former President Trump wins election in November 2024. You can see the complete list of videos we are producing in this evidence-based series. Our intent is to educate you with facts. We hope you will like our videos and subscribe to our channel. Today, we're focusing on the impact of Project 2025 on public health programs throughout the United States. Thanks in advance for your support. Public health programs are managed by the 50 departments of health for each of our states. State departments of health are funded by a combination of state funds, which are based on state tax revenues, and by grants from the federal government, which are flexible and based on need. The departments of health design public health programs for their state populations, such as educating the public about diseases and prevention, tracking disease outbreaks, vaccinating communities to avoid the spread of disease, setting safety standards to protect workers, and developing school nutrition programs to ensure kids have access to healthy foods. These programs play a crucial role in managing community health. In video 2 of this series on healthcare in red states versus blue states, we noted that red state household incomes and therefore taxes are significantly lower than in blue states. This means that the budgets of state departments of health in red states are lower because there is less tax revenue to spend. This means red states tend to invest less in public health infrastructure and services, which can impact overall health outcomes and the ability to respond to public health emergencies. We documented that a result of this lower funding brings about higher rates of both acute and chronic diseases. Why? Because there is less public health education and awareness and fewer services provided by the states. Now enter Project 2025. You'll remember that a major emphasis of Project 2025 is that, quote, states should be the primary regulators of the medical profession, unquote, from page 450. Project 2025, in order to save money, intends to cut huge parts of the federal health care budget. These savings would not be going to the state level. As a matter of fact, Project 2025 would replace the current generous, as-needed funding shared by the federal government with the states with fixed block grants to each state. This no longer enables federal money to be provided as needed. It limits federal funding to fixed amounts, regardless of the circumstances. These cuts would leave public health departments underfunded and understaffed, reducing their ability to protect and promote community health. This could lead to more frequent and severe public health crises with significant human and economic costs. Red states with already limited public health funding might face even greater challenges under Project 2025. Cuts to federal public health funding could further strain state resources, reducing the ability to respond to public health crises and manage chronic disease prevention programs. Blue states, which have higher household incomes and state taxes than red states, might be able to mitigate some of the impacts through state funding and robust public health infrastructure, but federal cuts could still lead to reductions in services and programs that promote population health, such as preventive care, mental health services, and substance abuse treatment programs. In conclusion, while Project 2025 aims to reduce federal spending and increase state and private sector control over healthcare, the proposed changes carry significant risks. The reduction in federal support for Medicaid, the rollback of ACA provisions, deregulations of private insurance, cuts to preventive services, and reduced funding for health care and public health programs all threaten to diminish health care coverage for millions of Americans. Thank you for watching. We hope this video gives insight into how Project 2025 will change healthcare in the United States. Please like this video so more people see it. Thank you in advance. And please subscribe to our YouTube channel so you benefit from all the videos in this series. This has been Jonathan Marks with Go to Health Media.